Flu season is already making an impact. There's even been some flu deaths reported, and kids are out of class sick.
School nurses in Lowndes County say they were seeing flu cases back in August. Our Cash Matlock talked to some Winston County medical experts today. He joins us in the studio with that story. Cash.
Well, that's right. Besides a few cases here and there, nurses at the Winston Medical Center say this season has been relatively slow. However, the CDC is urging healthcare providers everywhere to prepare for the worst.
Tibby Kuhn is the director of nursing at Winston Medical Center, and she typically doesn't start seeing flu patients until late October.
We haven't seen that many cases yet, but we hear that it's going to be early this year, so we encourage everybody to get out and get their flu shot early.
Kuhn says the hospital receives regular updates from the Center of Disease Control in Atlanta. This year, the CDC is predicting a very busy flu season.
Stay away from the flu, stay away from the hospital unless you're sick. Drink plenty of liquids, of course, take the flu shot, and just take care of yourself health-wise.
Adam Bird specializes in dermatology, but he works at Winston Medical Center several days out of the month, often treating flu patients. He says there's a big push for the flu shot this year.
Just trying to get everybody vaccinated as much as possible. Vaccination campaigns like they have here today. I think you can pay $25 and get vaccinated.
And he says there are some misconceptions about the vaccine.
Vaccination doesn't prevent all cases of the flu, but if it is a well-matched strain, it can reduce your risk by 40 to 60%, I think. You can still get the flu if you get vaccinated, but I think if you do get the flu, it might be less severe, and you might have a lot less risk of getting hospitalized with it.
Whether this year's flu is widespread or not, experts say it's smart to take precautions.
I advise people to come to the emergency room or go see their family physician and get tested, because we have tests for that, and we can determine whether they actually do have the flu and get the medication started early. That helps.
Worst case scenario, if the vaccine is not a very good one that year, I don't think there's much risk at all from getting vaccinated.
Well, doctors say it typically takes 2 weeks to build up your immunity after getting a flu shot.